I had had a few medical issues. I had had some chest pain and not feeling very well. Ended up going to the heart hospital in Sioux Falls and was diagnosed with severe anemia. So then saw my regular doctor's covering person, and they're just like, take iron. That following summer in June and July, just felt flushed, would wake up in a sweat. And at first it's like, okay, I'm in my 50s. Ended up going to the emergency room in Brookings, and very nice ER doctor said, you're having a panic attack. And about 2 weeks later, happened again, worse. So husband took me back into the emergency room, and they're like, took some x-rays, and he's like, well, I think I see something in the x-ray on your stomach, but take Nexium, do this. Ended up seeing Dr. Cruz, going in and seeing her and going, this is what's wrong with me. I am not a depressed person. I don't feel like I'm having panic attacks. I feel like there's something wrong in my body. And she heard me and became an advocate for me. And so began the journey of test after specialist after specialist. And then ended up going and having a video EEG done in the University of Iowa, ended up in Mayo. After all that, they ended up taking stomach x-rays, and they saw a problem in my stomach. And then they sent me to the partner of the doctor who had done my gastric bypass in 1996. And he's like, you have a fistula. When you look it up, there are a very small percentage of patients that have had gastric bypass that get these. So it is a known thing to watch for. And so it can cause all the symptoms that I was having. So got that repaired. It's called an overstitch, where they go in through a scope in your mouth and they go down and they access the hole. So it's a part of your stomach that's reattached. The part of the stomach that's not being used anymore is reattached to the stomach that's being used. And it just reaches out like a finger, or like I like to think of as an octopus. As for the stomach, I had the overstitch done, and then within about a year, I started having issues again, and I could tell, because I was so in tune now with my body, that I had a problem again. So let Dr. Cruz know, and she goes, don't even come see me, we're going to get you in to see Dr. Strand. Went and saw him, went in and did a scope again, and he's like, you have another one. So I ended up actually having a second one done here in October. And when all was said and done, she felt bad and said, knowing you had had gastric bypass, I should have started with your stomach. And she felt bad. And I said, no, this journey happens for a reason. I learned a lot about myself, and I've been able to tell other people, find a doctor who's going to advocate for you, and please advocate for yourself. You have questions or you need to follow through on something, do it.